Welcome, Tahlia and Leigh. Over to you.
Thank you very much. I'll just share my screen. If I'm able to share my screen. Okay, hopefully everyone can see our screen now. Good afternoon. Really great to join this forum. So my name is Tahlia Rossi and my colleague Leigh Smith, and we're both from Water Technology, and we're currently completing a project for Warrnambool City Council focusing on extreme heat. And in the context of climate change and human health, it's a really pressing matter as heat waves are often known as the silent killer and are the leading cause of mortality of any natural hazard. But before we get into our presentation, I'd just like to pay respect to the Peek Wurrung peoples and pay respect to their elders past and present, and extend that to all First Nation peoples. Just as a really brief overview of what we're going to be talking about for the next 20 to 30 minutes, we're just going to share a bit about our project scope and what we're finding so far, but importantly, we're really keen to leave some time at the end to discuss this and answer any questions as well. So the overview of our project, we are focusing on extreme heat in Warrnambool. The first two project elements are focusing on understanding the risk and the impacts and what that looks like in this context of the Warrnambool LGA. And then the second two elements are focusing on mitigation measures that can be put in place to reduce this risk. So while it's Leigh and myself presenting today, we do have a team behind us that have been completing this work. We're really lucky at Water Tech to have a multidisciplinary approach. So we're a mix of planners, scientists, and engineers. And as I mentioned, this project is looking across Warrnambool LGA as a whole to understand where the risk is distributed, what that looks like, and where priority areas might be to focus attention. So I'll hand over to Leigh and he'll share a little bit more about heat risk in Warrnambool.
Thanks, Tahlia. So understanding the impact of heat across Warrnambool is really critical from two perspectives. One is for community wellbeing and the other is in relation to critical urban systems. And we mean by that things like our healthcare services, transport, telecommunications and power, things that we take for granted on a daily basis, but that are put under extreme stress during extreme heat and heat waves. So the climate change projections forecasting increased intensity and frequency of heat waves for Australia. And it's important that we plan and mitigate for those risks now, acknowledging that they're going to get worse in the future. And it's the vulnerable members of our community who are most at risk. So the very young, the elderly, the sick and the socially economically disadvantaged. So in terms of the project, what have we set out to do? Well, quite simply, we're identifying locations across Warrnambool at most risk from extreme heat. And to do that, we're considering the historic climate and those climate projections. We're assessing the impact of heat on those urban systems and services. And we're going to be setting out a range of responses to mitigate those risks, which will include cool refuges and urban forests from a shade tree perspective. And we'll give a quick overview of those two elements towards the end of the presentation. But the information generated by this project will really help council and inform policy and planning around extreme heat, and importantly, also community engagement and education around extreme heat. So yes, believe it or not, Warrnambool gets hot. That's quite a catchy little phrase that. Hope it catches on. The graph at the bottom is the almost just over 20 years of maximum temperature data from the Warrnambool Airport monitoring station. And we can see the classic seasonal change in air temperatures there. Drawing out the summer temperatures in the top graph, December to March, those maximum temperatures across that 20-year record are consistently above 30 degrees. So yes, it does get hot in Warrnambool. For the first project element, we've been looking at heat mapping and modelling. So we've sourced those temperature data across Warrnambool. We've sourced data for some actual heatwave events that were experienced. And we've mapped heat exposure using two approaches. One is using a Landsat satellite thermal image of the LGA, to get land surface temperatures, and the other is modelling heat exposure using climate data, which gives the real feel temperatures. So a couple of key terms just to run through before I show you the results. Statistical area 1, that's the smallest geographic area that the Australian Bureau of Statistics use and collects demographic data on in their census. Using those in our project just enables us to compare areas across Warrnambool with each other consistently from a population density perspective. For land surface temperature, what we mean is how hot the land itself, the surface, actually gets, which is distinct to how hot the air feels. And then in terms of the thermal comfort index, this is how hot it actually feels for us from a physiological point of view. And the universal thermal comfort index is universally adopted now across the globe to measure heat or temperature stress, because it includes cold, not just heat, but we were interested obviously in the upper end around heat. So any of those temperatures that are above 30 degrees. And in terms of population vulnerability, the Australian Bureau of Statistics collects data on populations, and some of those indicators in bold here we can use to indicate vulnerable populations. So again, that's the young, the elderly, the disadvantaged, or those with limited mobility and languages other than English, which is really important from a community communications and education perspective. So we've used this data in our study. And to reiterate again, yes, Warrnambool does get hot. So the two heat waves that we looked at were from 2019 and 2022, and the 2019 heat wave in particular got pretty hot, just over 44 degrees there. So the results, they're presented in terms of heat exposure, vulnerability, and then hazard. And hazard is basically a combination of exposure and vulnerability. So the first exposure results are around land surface temperature for 2022. The second is that thermal comfort for 2019, and the vulnerability is based on the 2021 census data. So mean land surface temperatures in Warrnambool in 2022 looked like this. So this is the LGA, the bigger shape, broken into the different statistical areas, and then represented by mean land surface temperature. So there's a 10 degrees variation across the LGA in land surface temperature during a typical heat wave event. And interestingly, those areas outside of the CBD are hotter. And we can see that in the next slide quite starkly when we look at the maximum temperatures. There's a couple of reasons for this. There's an elevation driver here. So the Warrnambool CBD is slightly lower elevation, and it's also closer to the coast. So there's some moderation of temperatures going on compared to those inland areas that are generally cleared and further away from the coast. But there's definitely strong influence there. For the thermal comfort, this is taking the hottest part of the day from the 2019 heatwave event. And we can see that temperatures across Warrnambool were pretty consistently hot everywhere. We're in the moderate to high 40s. The other important aspect are nighttime temperatures. So this is where community can get some respite during a heat wave. And it's those multiple days of really hot temperatures that are really impactful on well-being. So having no thermal stress overnight is actually really critical to allow people to recover before the next hot day. When we look at thermal comfort across the LGA, again, we can't really see a whole lot of difference. It's pretty hot everywhere, and we're only looking at sort of matters of a few degrees difference between different SA1. But when we look at vulnerability from the census data, we start to get some distinction between the areas. So what we're interested in here are those darker vulnerable areas. There's about 10 SA1, and they're all sort of clustered in and around the central areas of Warrnambool. And then when we overlay the heat exposure onto that, we get this map. And again, the darker areas are those that are highest hazard from a heat perspective. If we go to the next map, we can see where they actually are in Warrnambool. So these are the 10 SA1 that are high heat hazard. And we can see there's clusters in West Warrnambool, Central Warrnambool, and Eastern Warrnambool. So the findings of this bit of a study have showed us where in Warrnambool the high heat hazard areas are, and have given us some data on how hot we're talking about. And land surface temperatures get hot, 45 to 50 degrees. And the thermal comfort is also above 40 degrees, which is high stress. So that's going to have an impact on community and on our infrastructure in our urban systems. So what we're going to be doing with the reporting and the project is elaborating on those 10 locations in terms of the risk to community wellbeing and that infrastructure, and provide a bit of an indication on what that might mean into the future with those climate change projections. So I'll just hand over to Tahlia now, who's going to talk more about urban systems.
Thanks, Leigh. So moving forward from that strong database, we're able to think about what does that mean for urban systems. So really wanting to understand here what the likely impacts are for different systems and networks, and really importantly to overlay the geographical extent of heat, the social vulnerability, and then where the key assets are. But not only it's the physical infrastructure, but it's also thinking about the connectivity between systems and what those cascading impacts are. So just to take a little step back, why are we thinking about urban systems? Why does it matter? So we know population is increasing. That means that more people are now relying on our critical systems and services across electricity, water, transport, and health. And with the lens of climate change, we know predictions are increasing risk, but it's also meaning that events are happening in quicker succession. So there's more interconnection between the shocks and stresses that these systems have to withstand. So it's really important that we think about these things and do some forward planning. So what we're referring to when we say urban systems is just simply kind of the essential services of a city and a township. So this is energy supply, health and emergency services, telecommunications, transport, and water supply as kind of key sectors. There is other obviously really important components of cities, but this is what we're focusing on for this project element. And across all of these systems, there's the physical infrastructure and the assets, but there's also that operational planning that happens in the background and service planning. And then there's also the workforce personnel, which is a really critical component to consider about the health and safety of especially outdoor crew and things like that. So this is such a varied range of stakeholders that have a part to play in how cities function. And for Warrnambool, this is some of the key stakeholders across the urban fabric. It's a real mix of public and private, and there'd be so many more, and I'm sure people in the room represent others that have a really critical role in providing essential services as well. So when we start to think about what the impacts might be, about that data and the findings that we have from the beginning of this project, where we wanted to start was to ask stakeholders. So if we're thinking about what these impacts are, the best thing is to actually ask people that are representing those systems. So we held a urban systems workshop last month, just a few weeks ago, and it was a really great a starting point just to start to understand what some of those key impacts and priorities are currently for different representatives from those systems. So we're able to share kind of the scope of our project, but really importantly, it was just an opportunity to hear from different stakeholders. And it was only one workshop, so it was really just one snapshot into it. There's so much more conversation and so many more stakeholders that could be engaged and would have a lot to add value in this conversation. But in that workshop, we're able to get an initial sense of what infrastructure and operations that people represented, what the interdependencies are from their perspectives and initial understanding of vulnerabilities in the system currently, but also to get to understand a bit more about what current planning for heat hazard is occurring across those different systems. So just as a quick reflection from that workshop, as I said, it was a snapshot of one point in time and from a small group of representatives, but it really reiterated that there are so many impacts across these systems from heat risk. and also just the interconnected nature of these systems. So, for example, power outages, while that's one impact to one system, the flow-on effects of that across different systems and also to households and individuals, and then their own personal heat health risk as well. It's such an interconnected system to consider. And one of the key things that's coming out of this is just the opportunity for more collaborative planning in this space between different levels of government and those network providers. So using that information, we're currently finalising what some of our key recommendations and key insights are from overlaying the literal hotspots around the LGA, considering where those demographic vulnerability priority areas are, and then thinking about the direct and indirect impacts from heat stress and heat hazard across this range of urban systems. So yeah, that's the snapshot of urban systems. I'll hand back to Leigh to talk through that other component.
Thanks, Tahlia. So cool refuges. So one of the key things from a mitigation perspective is making what we call cool refuges available, particularly to vulnerable people during extreme heat. And quite simply, a cool refuge is a place, a space where community members can go and keep cool. So buildings across the LGA that are made available, and this could be a mixture of council buildings, other public buildings, even private buildings where there's an agreement for that building to be used during a heat wave. And interestingly, it's not just the availability of the building itself, but there needs to be people, volunteers or other staff members actually running the location as a cool refuge during those heat waves, because you need to provide things for people to do, tea, coffee, things to eat, games to play, occupy people. But also importantly, people need to be on site that can recognise heat illness and refer potentially people that are suffering to medical assistance. So these refuges are really quite important. And heat waves are deadlier than other natural hazards in Australia. And this is quite a phenomenal bit of statistic there. But knowing that they're going to increase in intensity and frequency means that and the impact on community well-being needs that we need to start putting planning in place around these cool refuges as one mitigation measure. So what we're doing in the project is developing guidance on how to go about investigating the suitability of buildings as cool refuges and focusing sort of efforts on looking at what's available in those high heat risk locations that we've identified in the LGA. And this will give council the opportunity to work with partner organisations and building owners to develop a bit of a stock of refuges across the LGA in key areas that can then be part of council's heat response plan. And I'll hand back to Tahlia to touch on the urban forest.
Thanks, Leigh. So the fourth component of this project is another mitigation measure that can be really effective in lowering ambient temperatures and surface temperatures, is just introducing more shade canopy across the LGA. So the approach taken for this element is, first of all, baseline, so reviewing what's currently in place. Also, we're thinking about what species of trees are going to be viable going forward. So we know temperature projections are set to increase. We want to make sure whatever planting stock is being implemented will be able to withstand the changing climate. So part of this, our ecologists have been working closely with council arborists to understand and get better insight. And then relying on that base data from the project element around the heat hazard mapping, it's then identifying priority areas to implement to increase the shade cover for cooling. So some of the early findings is Warrnambool has a relatively low canopy cover across the whole LGA. So there's around 8% of the LGA is actually shaded from trees. And this might be a few things driving this. So there seems to be a sentiment around trees that are considered to be more of a liability than an asset. And there's also council was mentioning some understanding of resident reluctance to allow further planting, particularly on nature strips and things like that, where we understand there's sometimes narrow streets which results in people parking on the nature strip. So if there were trees there was a hesitancy about the impacts to how they operate in their street. And there seems to be a bit of a preference for keeping those nature strips grassed or even concreted. And also kind of concern around potentially losing coastal views if there's more vegetation. Another kind of finding or insight is around the iconic Norfolk Island pines that are around Warrnambool. That these trees can be up to 100 years old, and they can be that kind of coastal icon. However, as the name suggests, they're not endemic to this region, so they do present a few challenges. And then finally, there's Warrnambool is quite windy, so that can really limit what trees are appropriate to plant. So you can see on that top image the evidence of that wind pruning that can occur. So that's something to consider in species selection, because we want to make sure whatever trees are being planted are going to be effective and survive. But really interesting, this image in the lower corner is taken in a newly developed retirement village style development. And as you can see, there's not really a tree in sight, which is really interesting to consider as retirement villages are likely to house people in that age vulnerability category, which may have physiological susceptibility to increased heat stress. So yeah, there's a lot to think about in how we approach the urban forest planning going forward.
So to wrap up, where the project's going next, we're essentially finalising our reporting across all of those 4 project elements, so documenting our methods and our results and findings, and a bit of a guidance on what to do next. And that's going to provide a good foundation for council to work on, particularly in a collaborative space. You know, the workshop, as Tahlia mentioned, identified there's a range of partners across the LGA who are involved in managing and responding to extreme heat. So there's plenty of work to follow from this project. And if there's people in the audience here today who either work in respect of extreme heat or have a interest in finding out more, please feel free to get in touch with Justin, who we've been working with at council.
Good. Well, thanks so much.
Thank you for that. Justin, he was here this morning. Is he here still? No. He's in and out. So thank you. Tahlia is actually based in Brisbane and Leigh's in Melbourne. So thank you so much for your time. And we look forward to seeing where this project goes, because you're sort of in different phases of the whole project. So yeah, thank you.
Pleasure. Thank you.
Thank you very much. And if there's time, and it works on your end, we're very happy to answer any questions that people may have.
Does anybody have a?
And one way we could do that, I know, is I can't see what it looks like on your end, but I'm imagining a big hall or something exciting like that. But if you wanted to type in questions, you can scan this QR code or go to menti.com on your phone browser and type in that code, and then we can see questions popping up on the screen and we'll be able to talk to them.
We do actually have one question for you.
Yeah, go.
Hi, this is can you hear me?
Struggling to hear.
Does that work?
Yeah, it's Leah from the Western Victoria PHN. Just got a question about a great project. We'd love to replicate something like this to demonstrate the co-benefits. What influence are you having internally based on that you showed us, an aged care facility that might have been approved through planning? What influence, can you share that you're having on, changing those plans to incorporate more sustainability and more environmental change within, your very own organisation?
Yeah, that's a great question. So we're actually a consultant that's doing this study on behalf of council. We would definitely hope that the results of our study can then inform future planning scheme amendments and other mitigation plans and strategies that may be put in place. But yeah, I can probably talk to what we would imagine that this could be used for, but probably council would have to respond to how they plan to use it as well.
Thanks.
Thank you.
With Ingrid.
Hi, so I'm Ingrid Bishop, Director Community with Warrnambool City Council. So this is exactly the reason why we're doing this piece of work. So we're really opening ourselves up to thinking about what are the key points and what are the key areas that we need to start to really understand. How do we apply the thinking? What does that mean for our planning, town planning, in my area, particularly community development. So this is exactly what we are hoping for, because this is where the gold is. How council, as in the councillors, how they're understanding this, how they will want to see policy change across the organisation and obviously across the municipality. So this is the evidence bases that we need, and this is the data that we need, so that when we push this up, we are pushing up in a very informed way, so that our councillors, bearing in mind that most councillors aren't experts in this realm. So we need information and data to go to councillors that is easily understood and is backed by really rock solid data and evidence. So great question, thank you. But that's exactly the intent of this piece of work that we're doing.
Great, thank you.
Thanks, Ingrid. So I can see we do have one question that's come through Mentimeter. So the question was, are you taking into consideration neighbouring towns that have higher heat stress and then need to use Warrnambool as a refuge? And that's such a fantastic question to think even broader than just this LGA. In this particular study, as we are doing this project for Warrnambool, we are focusing on the LGA as one boundary, but that's a really great prompt for us to also maybe discuss with council and think about regional, even wider than one LGA focus.
And I'll add to that as well. It's sort of part of the cool refuge thinking is how do people get to cool refuges? So if they live in a vulnerable area, but there's a cool refuge not available, a few Ks down the road, how do they actually get from A to B during a heat wave? So there's an element of thinking about the transport network and making particular services available to vulnerable people to access cool refuges. And it could be as simple as a bus pickup. But yes, very, very great question. And it prompts that sort of broader thinking around it's actually a network approach, not just individual locations.
Yeah, thanks, Leigh. We have a second question around, are there good examples of communities with cool refuges and staffing and other facilities? So one case study we can refer you to is a project. Some of the people that are leading that cool refuge planning element of this project have previously worked for a council in Sydney. So Western Sydney went through a really comprehensive cool refuge planning project over a longer period of time and have some great information online. We'd be happy to circulate a link to that example to council that could distribute.
That'd be great. Yeah, thank you.
No
We might
worries.
stop there. Thank you again for your time. It's been really informative. It'll be very interesting to see if other local government areas actually sort of step into this space as well. So there's probably a lot of shared learnings there.
Definitely. Thank you. Thanks for having us.
Thank you.
Okay. Bye.
Bye.
Ashish has just got.
So the data that will come out of this is every municipality has a municipal heat wave plan. This will inform the heat wave plan. And to answer one of the questions around, what is going to be the impact of the region using Warrnambool as a refuge. And we have to look at the infrastructure that council owns, as well as all the infrastructure that are owned by different organizations in the community. And that discussion is going to start post this forum today. Once the results are, finally submitted by Water Technology to Council, that conversation will begin, and we will make an effort to do that at a regional level.
That's great to hear, Ashish. Fantastic.
Thank you. So we're going to have a break from Zoom. It's, pre-COVID, we would never have thought that we'd have a hybrid type forum. But one of the directives from the working group was to make sure that, we wanted face-to-face time. So it's been really good to be able to get some really high caliber presenters face-to-face and Zoom. So thank you for that. So our next speaker is Dr. Sue Brumby from the National Centre for Farmer Health. And her title is High Heat Day. So everything's just feeding in nicely. It's almost like we've deliberately ran the presentations this way. So the high heat days and presentations to accident emergency in regional Victoria. Sue was the founding director of the National Centre for Farmers Health, based in Hamilton, as many of us know, from 2008 until 2021. And she brings a unique blend of practical and theoretical experience in both healthcare, governance, education, and agriculture. Originally trained as a nurse and a midwife, she then moved into managing the family farm, producing beef and fine wool. Her PhD was on farm work and family health across selected agricultural industries in Australia. And she's been chief investigator on numerous research grants relating to agricultural communities, presenting nationally and internationally. And she's a board member of the Western Victoria Primary Health Network, of which we have representatives here today, and also Warnum Water, of which we have representatives. She's passionate about regional communities and the ability to make a difference through research, translation to improve service delivery and education and training. And so this is an example of where research really hits reality on the ground action. So I'll throw over to Sue for her presentation. Thank you.
Thank you very much. Great to be here. It's great to be in person and great to be local. I would like to acknowledge the land on which we're meeting today and pay my respects to elders past, present and emerging. I'd also like to acknowledge the colleagues which we did this research, which was Jessie Adams, who did a lot of the data around this, and she is currently finishing her PhD, and so is an apology today. She's got about 20 days in which to hand in her PhD, so she's definitely not here. Kate Clute, who works with Deakin and Southwest Healthcare, Tim Baker, who also works at Southwest Healthcare and with Deakin, and Dr. Mohammed Mahibi. Thank you. For those of you that don't know where we are, we're actually based in Hamilton, and we're a partnership with Western District Health Service and Deakin School of Medicine. We were established in 2008 at Hamilton Base Hospital in this lovely Federation style house, which used to originally be the maternity ward. So people come in and go, oh, I was born here. We focus very much on farmers is our key interests, rural communities, farm employees, families, and also work internationally with farming communities in third world nations. As we know, and as very clearly outlined to us this morning, the climate is changing and weather conditions are becoming more intense and more volatile. If we have a look at this graph shows us very clearly the number of high heat days increasing over the last 100 years. We've also heard today that heat kills more than any other natural event, and that it accounted for over 55% of the total number of deaths due to natural hazards. It causes death through a variety of means, but primarily through environmental exposure, metabolic demands, poor cooling mechanisms, and the body being unable to disperse heat adequately, resulting in hypothermia and dysfunction. As we all know, it can be pretty mild. You can get a heat rash, or you can get a heat stroke, or you can die. And usually there's a couple of cases every year across Australia in agricultural communities where people have actually died due to heat. So what is already known? Most of the research has actually been done primarily in metropolitan parts of Australia and indeed internationally. It's great to see the work being done around Warrnambool, the last presenters. That was Tahlia and Leigh. I thought that was really, really interesting and great to see that happening and how Warrnambool City Council responds to that. It's one thing to do the research, it's then how we all respond to it, isn't it? Certainly, we know that when high heat occurs, we see normally on high heat events increased admissions for things like kidney disease, indeed mental health illnesses, heat-related injuries, asthma, heart disease. That in the 2009 Victorian heatwave, which has already been alluded to this morning, and also the more recent bushfire ones, which was really interesting. I hadn't actually seen that data before. We saw 374 more deaths back in 2009. And that created a lot of impetus for health services, certainly where I work, to actually have a list of vulnerable people. There were a whole lot of things that we started thinking about as a result of that 2009 heatwave. Certainly working in agriculture, people that work in agriculture are deemed a high-risk population, primarily because they work outdoors. But research has been pretty slow on looking at the heat-related illness. We do know that there are also increased ambulance calls out and increased hospital admissions for heat-related conditions in Victoria. There hasn't been a maximum temperature set under the OH&S Act for workers to stop working. Some workplaces stop at 35 degrees and decide whether or not it's safe to continue. Certainly, work in the US, a lot of places have put in maximum temperatures. This paper, which was done by Mason, King, Peden and Franklin, was only just currently published in 2022. So it actually missed our paper, which was published also in 2022, on which a lot of this work is based. So we're not included in it. But what is really clear is there's very little work done on heat waves outside of metropolitan areas. And certainly, though, Queensland has been leading the way looking at this. So it's a clear message that we certainly need more research. So our study aimed to determine and understand the prevalence and characteristics of heat-related illness in rural southwest Victoria using what is colloquially called the radar data set, which is fantastic because often the only data sets that were available were from the very large regional and metropolitan hospitals. So places like Hamilton or Portland or Colac may not have been included. So you can see here, we've actually got the data from Otway Health, Colac Area Health, Timboon and District Healthcare, Southwest Healthcare, Camperdown, Terang and Mortlake Health Service, Southwest Healthcare, Warrnambool, Moyne Health Service, Portland District Health and Western District Health Service. We were looking particularly at the admissions from the 1st of February 2017 to the 31st of January 2020. And between the warmer months of November to March, which a few people have also mentioned those timeframes this morning. We aim to compare the frequencies of ED presentations of individuals from farming towns with non-farming towns in the southwest. And the map shows the locations. It wasn't as simple as it sounds. It required quite a lot of thought and discussion around how would we actually measure this. It was one thing to have the data. It was another thing to work out who were farming people and who were not, because that's not actually collected occupation. And also how you decide what is a hot day, because clearly, as we've heard this morning, just from the last speakers, as you leave part of Warrnambool, it gets hotter very quickly. And I'm sure many of you have driven from Warrnambool or Port Fairy to Hamilton, and you've realised that as you've gone towards Hamilton, the temperature has increased rapidly. So we had to think about our data collections, and I will go into that. So firstly, weather data on or identification of high heat days. There is no Australian or internationally agreed upon definition for high heat days. There's a lot of discussion around this more recently. After reviewing the literature and previous studies investigating heat-related illness, days over the 95th and 99th percentile were identified as regularly used definitions. After calculating this, it was determined that we would use the 95th temperature percentile of the months included in the study, November to March, as otherwise there wouldn't have been enough days in the 99th percentile. It was actually it was a relatively cool period, which is how it goes, isn't it? Data was downloaded from each of the weather stations closest to the hospitals, using the Bureau of Meteorology, which is shown on the table. This was done as the climate for each location was slightly different, with some coastal and some inland, and acclimatizing to heat is a factor in heat-related illness. The temperature cutoffs for each location are shown in the table and range from 33 Celsius to 36.8. Not that hot, actually, in comparison to other calculations. We then had to think about the diseases and the conditions. So there's a code called the International Statistical Classification of Diseases and Related Health Problems, and in particular, we use the Australian modification. These are showing you the major diagnostic blocks of what we felt would be using clinicians' advice, particularly Professor Tim Baker's, of what are the things that are likely to be seen in emergency departments. Secondly, the other key thing was that there are heat-related illnesses and heat conditions influenced by heat, but they're often not actually identified in emergency departments. Previous literature has highlighted that while heat precipitates a large number of conditions, the heat-related codes are very rarely used in emergency departments, and clinicians tend to revert back to, I guess, more generalized ones. So the real heat-related codes are very rarely used. So we were looking at things that could exacerbate other conditions such as these major diagnostic blocks. Then we were trying to ascertain, our interest has always been in farming and agricultural communities specifically. So we wanted to identify farming locations. Occupation is not collected in the hospital database, so we had to develop our own framework for identifying farming towns, as very little work has previously identified towns with high farming populations. This framework, which is described on the slide, and I'm happy if anyone would like to get hold of that, if I know it's hard to read. The framework considers a few factors when determining a farming location. Firstly, town statistics, so population and employment in agriculture. We then visually Googled every town and actually had a look at the cluster of houses and the presence of farming characteristics. Other considerations included local government area, employment in agriculture, and the modified Monash model, which looks at remoteness. A percentage of the population involved in agriculture was then estimated. In the end, for example, a town was classified as a farming town if it was estimated than greater than 70% of the population involved in agriculture. This framework was developed by the research team, and then it underwent inter-rater reliability testing for 110 towns with 3 independent researchers receiving over 90% agreement. 433 towns and locations were rated. Using these 3 data elements, the temperature, the hospital admissions, and farming and non-farming, data was extracted and analysed using SPSS, which is a statistical package. So there were 61,631 presentations that lived in the 9 LGAs over the 453 study days over that period from November to March. In terms of the weather, 5% occurred on high heat days, or 3,064 presentations, and 95% on days of non-heat, 58,567 presentations. In terms of farming towns, 7.4% or individuals were from farming towns, and 57,092 were not from farming towns. Okay, here comes the fun. So, injuries were the most common type of presentation for all groups. As you can hopefully see, there was a drop on the days of high heat days. Now, this is really interesting, because this isn't, we kind of weren't expecting to, what we found, and it isn't what we expected. So that's the benefit of doing research. So the first thing was injuries were the most common. So that's probably reasonable, and they dropped on high heat days. Okay. Musculoskeletal and connective issues, such as neurologic system illnesses and other presentations, also declined on high heat days for farmers. Circulatory systems and respiratory system illnesses increased on days of high heat. And similarly, in non-farming groups, circulatory system illness and other presentations increased. But overall, farmer presentations decreased by 21% and non-farmers 7% on days of high heat. Okay. So what did we actually also find out about the characteristics of all these thousands of presentations? Well, the farming cohort was slightly younger. So, and that was significant. Overall, more females presented to emergency departments, but there were more males presenting from farming towns than women from farming towns. And that's probably not a surprise. And that was statistically significant. The majority of presentations arrived in other transport methods. That is, they were not using ambulances, and they were including private cars. Now, I think in the future, this is an area that we need to also be thinking about in terms of how the region works together for ambulance and emergency transports. The majority of presentations were classified as urgent or semi-urgent. The majority of cases were discharged home. On high heat days, however, More farmers were admitted to hospital and less were discharged home compared to non-high heat days, potentially suggesting they were more unwell. And remember that there were more admissions for heart disease and respiratory disease, but less for injuries. We then wondered about this, and also, was the effect related to age? Was it related to gender? Was it related to socioeconomic disadvantage? Or was it related to the Monash medical model, i.e. where you live in, determining rurality? So we did a logistic regression which showed that when you compared the prevalence of presentations to emergency departments on high heat and non-high heat days with farming town status, after being adjusted for age, gender, location, and index of socioeconomic disadvantage, farmers were still 17% less likely to present to emergency departments on high heat days compared to those from non-farming areas. So what did this show us? Well, firstly, the findings were quite unexpected, given all the literature that had been around, particularly, again, done mainly in metropolitan areas, was that you see an increase in presentations on days of high heat. So what our findings have found was that overall there was a decrease in presentations to emergency departments and urgent care centres on days of high heat. And that applied across the board for the region. Farmers were 17% less likely to present on high heat days than non-farmers. Increases in circulatory system illnesses were higher, and that was consistent with previous research. The decrease in overall presentations suggests that farming populations are aware of the risks of working in high heat conditions, possibly also want to stay home and be on the farm and adapt their behaviours accordingly. Other suggestions have been that because a lot of farm businesses are family owned and operated, there is an ability to increase your rest periods, self-pace, get up early, do the most strenuous activities in the cooler parts of the days and work under shade or ventilated sheds, obviously increasing water and wearing appropriate clothing, or just not doing anything much at all on those days. I think as an LGA kind of learning though, the reduction in injuries across the whole landscape is really kind of exciting and interesting. It means people are far more careful and less likely to be using machinery or doing sports or things that are likely to cause injury or result in emergency department admissions. And that's good news, and we should, use this information to actually say, well, people know about how to protect their health on these kind of days. How do we actually help people that are more likely to be having respiratory illnesses or cardiac events to actually modify their behaviour? Some of the other areas that we're now looking at, and we are working around the region at local government areas to see what shires and health services can do. But I guess what the results highlight is the importance of doing local research, that not one size fits all in regards to heat-related illness. The impacts of heat waves in metropolitan areas appear more severe with the built environment retaining heat, and characteristically commonly presenting in rural and regional populations can increase the risk for heat-related illness. But basically, there's a need for public health responses to be prepared for our own local defined temperature thresholds as communities do acclimatise to their own climate. Identifying local at-risk populations, increasing public awareness of heat-related health risks, celebrating the fact that injuries drop on days of high heat, identification of local hazards, potential exposures, and thinking about contextual messages, for example, to farmers or agricultural workers, or for people with cardiac and respiratory conditions through social media and organisations and community groups. The education, particularly around circulatory and respiratory system illness, is really important. Going forward, we're starting further research into the effects of consecutive days of high heats and days after high heat events to help us understand the bigger picture, and working with Elvira here in Warrnambool on that. Also looking at transport to EDs in rural areas, people using so many of their private cars and the risks to that as opposed to ambulances. I did want to do a plug on the way down today. The ABC was doing a whole lot around women and heart disease, and we're just looking at women's experiences who have had heart attacks or have coronary heart disease, and the way that they may have had a gendered experience of not being treated the same way as, or as well as, men may have been. And we're really keen to get people to participate in this focus group. And we want rural people, because this is quite a metro-based project. So we're trying to get rural voices. So please, if you know anyone or would like to participate in these focus groups, it would be really great to hear from you, and also really important in relation to our heat work as well. I'm very happy to take questions, and happy to go back to this other slide if you didn't quite get a good grasp of that. Thank you. Crikey.
Hi, Sue. Good to see you, Matt, from the PHN.
Thanks.
I was just reflecting the data that seems to suggest that behaviour modification in high heat days amongst farmers results in some good outcomes, fewer presentations, fewer injuries, all of that. I'm just wondering whether it could be worth us thinking about using that to then sort of engage a bit of that nudge theory to then spread, you know, use it as a comms piece to say, farmers know the land, they know, you know, they're on the land, they know the land, and this is what they do. So we should all think, you know, if this relates to us, and, you know, we could learn a bit from that. So yeah, I'm just interested in if you think that's something that we ought to have a bit of a think about.
Yeah, thanks for the question, Matt. We pondered, because kind of my reaction to that was, oh, that's because they're all home. It's a fire ban day and everybody's laying low. But it didn't coincide actually with fire bans, or very few of the high heat days identified. So that kind of blew that out of the water. We are now looking at, and Elvira may want to comment, we're now looking at a broader days to see actually, yes, this is good news, but are there actually more admissions 2 or 3 days after the heat event? Because people, particularly with circulatory illness and respiratory, may then present or even die days later, sort of thing. So that is what we're now starting work on with Elvira. And the other aspect is like the injury stuff is really kind of fascinating, because it was right across the region. And so that means people are thinking about reducing their risks. So that's a good news piece. So yes, I think we could, but we probably also need to temper it with, if you have heart or respiratory conditions, you need to really seek help early, because they were getting admitted at higher rates as well. They were clearly sicker. Does that kind of help? Yeah. Thanks, Matt. Thanks for the question.
Thank you. There's a lot of food for thought there, especially the comment about using private vehicles instead of ambulances. And if they are leaving it to the last minute, then the fallout of that. So on behalf of the working group, we'd just like to give you a little gift.
Eggs, caravan eggs.
Yes.
I love that. Oh, that's a plug, isn't it? Thank you.
So the gifts today to the presenters have all been locally sourced. We put a lot of thought into trying to be climate.
Elvira, do you mind standing up in case people have questions? So Elvira is working with us on this as well. Thank you. Thank you.
Thank you. So we're actually have reached lunch, which is great. So
Yeah, then calling all that from a military that once the council is pretty free, like boil down and then oh, then yeah, and had a jam for the I think